We begin at the Georgia State Capitol, where the House has passed a bill that would allow pharmacists to prescribe a medication that reduces the risk of getting HIV. Atlanta is a major epicenter for the disease. Our Daniel Wilkerson has the details.
For many, taking PrEP, the preventative HIV medicine, isn't about just deciding to take it. It's about getting an appointment, doing lab work, getting a prescription. Well, some lawmakers are looking to simplify that.
This is a type of Monstera.
Leo Hagler has a busy life. He and his husband, Tobin Hagler, own 11 short-term rentals and run a construction company. Leo is a yoga practitioner, dog sits, and makes time for his plants. The Haglers are in an open relationship and say HIV prevention is a priority.
It represents autonomy. It represents control of my sexual health, my body.
For years, that started with a doctor's appointment. Now, Georgia Senate Bill 195 would allow trained pharmacists to prescribe PrEP. According to the Centers for Disease Control and Prevention, most PrEP users are gay and bisexual men. In high prevalent cities, including Atlanta, the CDC says about 32% of sexually active heterosexual adults have heard of PrEP, but fewer than 1% have used it. Dr. Andrew Wilson, a pharmacist in Dunwoody, says under existing law, pharmacists cannot prescribe PrEP.
So right now, we would have to tell them that they would need to consult with their doctor.
Pharmacists would have to complete state-approved training and follow CDC guidelines.
As far as people in rural areas who don't have great access to a doctor, it would give them a place to go for the medication.
Whether or not the law passes, every 3 months, patients must get lab work, check kidney function, and confirm they are still HIV negative. Two of the bill's sponsors, Republican Senators Chuck Hufsteller and Kate Kirkpatrick, told CBS News Atlanta the legislation does not change monitoring requirements and that patients would still be referred to a provider for ongoing care. Hagler says that's a potential roadblock.
After the first 3 months, if you don't have access to the checkup, then you can't, even if the PrEP is there, you can't get it prescribed.
Janario Scott has lived with HIV for a decade.
It would have been accessible for me. I would have been able to go to the pharmacist and get PrEP. I would have done it.
Hagler says just recently, he and his husband joined a study testing a once-a-year shot that works similar to PrEP. For him, it's not just about easier access. It's about a future where HIV is no longer a threat.
Aid Atlanta is among the organization's leading efforts to prevent the spread of HIV here in Metro Atlanta. Meanwhile, as for this bill, it has already passed the Georgia House. It now heads back to the Senate. If it passes the Senate, it will head to the governor's desk.